Shortly thereafter, there was another publication where they compared vegetarians to meat eaters, and the vegetarians actually had a lower risk of stroke. And in the second cohort, actually a lower risk of hemorrhagic stroke as well. Of course, that got zero media attention. Fracture risk in those who were supplementing calcium alone, there was still possibly an increase in risk. And then in those supplementing both vitamin D and calcium, the risk seemed to be just abolished, and it, possibly even a lower risk than the meat eaters in that same group.
We get lots of claims made very frequently against plant-based or vegan diets. There was the EPIC Oxford study. They sort of created a few headlines because they were sort of saying that vegans may be at risk of reduced bone health. Well-planned plant-based diets, they can be helpful for bone health, and they can even lead to reduced calcium loss. Dr. Avi Bitterman discussed the problems with this paper. I don't know if you've seen this video of Dr. Avi Bitterman, but they were talking about problems of how they adjusted the confounders. They sort of picked the wrong ranges to adjust. Mm-hmm. Have you looked into this paper, or have you got anything extra to add?
Yeah, I did. I did a whole talk on this topic actually for Plant-Based Canada last year. So, and I've definitely used a lot of information from Dr. Avi's video as well. I mean, he did a really good job. Actually, I should mention he also does a good job breaking down the heart disease reversal claims. If someone wants to check out that video, it's a really good one too. But yeah, so the EPIC Oxford study, this was including tens of thousands, I can't recall the exact number of vegetarians and meat eaters in the UK who were enrolled primarily from mid-90s through the early 2000s, I think up to 2001. And they looked at fracture risk over the course of about a decade, if I recall. I'm sorry, going off memory here. Now, within that, there was no significant association between vegetarian diets and men and fracture risk. It was specific to women. And if we look at post or premenopausal women, the results were statistically significant for postmenopausal women, not for premenopausal women. Doesn't mean that the association wasn't there for premenopausal, but we can certainly be more confident in the results for the postmenopausal women. It was also amongst the inactive or vegetarians with low levels of activity and those with a BMI under 22.5, which is kind of about 2/3 up within the normal range, or what's considered the normal range for BMI. When you look at those with a BMI above 22.5, there was no significant association in the vegetarians. Now, in addition to seeing an increased risk of overall fracture, I think it was a 43% increase in risk. There was also an increase in risk of hip fractures specifically. That seemed to be kind of one of the main ones. Now, there are a few issues. For one, there was no consideration for vitamin D intake or status. And in this population, it has historically been seen that vegetarians did have lower vitamin D status. And even dipping into at least the cutoff for deficiency, although there's some debate to be had around that cutoff in the wintertime. Now, that might explain some of the results. Perhaps they had lower vitamin D intake and status, and they just didn't consider it and obviously didn't adjust for it. So that's one issue. The other issue potentially is calcium. The vegetarians had a pretty low calcium intake, below the recommendations in the UK, which are actually lower than here in North America. Here in North America, the recommended dietary allowance is 1,000 milligrams a day. In the UK, it's 700. And there might have been some issues with the way they adjusted for that. But if you look at just those who at least achieved 700 milligrams a day of calcium, there was still a significantly increased risk in the vegetarians and vegans. So still not really solid, or at least that doesn't explain the results fully. Now, where we do see a bigger issue potentially is with BMI. So as I mentioned, in those with a BMI of at least 22.5, there was no significant increase in risk amongst the vegans. But in those with a BMI under 22.5, there was. Now, if you look at the number of vegans who had a BMI under 20, there were very few meat eaters with a low normal to underweight BMI, and there was a relatively large percentage of vegans with a BMI of 20 or below. This is a problem because they didn't consider differences in BMI below 18.5. So 18.5 is the cutoff for underweight. So anybody who fell into that underweight category was being compared to one another, essentially. But the issue is, if there's a large percentage of vegans with a BMI that low, and perhaps some of those vegans are very underweight with a BMI of like 16 or 16 and a half or something, then that is going to skew the results, because chances are, as far as the meat eaters go, most of them are hovering around the like barely underweight category based on the percentage of them that are actually in that group. And so that is going to skew the results, because risk of fracture skyrockets when you get into that underweight category. The further you get down that scale, the higher the risk gets. And this probably explains the results. They were just not eating enough to support their body weight, and that was ultimately having their bones suffer. And actually, one of the things I forgot to mention with the fracture risk is only about half of the vegans supplemented anything, let alone vitamin D specifically. Another reason that we think vitamin D might have been a little bit of a contributor there. And that just goes to show that, like, education-wise, this group probably wasn't super knowledgeable. And you have to remember, they were largely enrolled in the 90s, and that's before fortification was as present as it is now, or prevalent as it is now. And supplementation might not have been as easy, or at least people didn't know exactly what they needed to take. Now, we have another study that was published the following year, the Adventist Health Study 2, where they took a group of meat eaters, vegetarians, vegans, who are relatively healthy, generally considered to be quite health conscious and quite healthy. And they enrolled men and women who are 45 plus, or for women pre-post or peri-postmenopausal. And once again, in the men, there was no significant increase in risk, but in the women, there was. But then they stratified the women by supplementation, the types of supplements they were taking. In those who were not supplementing at all, there was a much higher risk of fracture in the vegans. But in those who were supplementing calcium alone, there was still possibly an increase in risk. It wasn't statistically significant, but generally suggests that there's a chance of them being at higher risk. And then in those supplementing both vitamin D and calcium, the risk seemed to be just abolished, and it, possibly even a lower risk than the meat eaters in that same group. So this just emphasizes that, based on the two studies, one, you definitely want to make sure that you're at a healthy weight, and two, you want to make sure you're getting those nutrients that might be important for bone health, like calcium and, of course, vitamin D, particularly if your calcium intake is a bit lower, as it can be with vegans if you aren't having fortified beverages. There aren't huge concerns when you take all that into consideration. There's just a few things that you want to make sure that you're hitting. And obviously, physical activity is really important. There are non-dietary factors like that. But as far as diet goes, eating enough, definitely key, and making sure you're getting a good solid source of calcium and vitamin D, particularly if you live in a northern latitude where maybe you don't get a lot of sunshine, for the vitamin D, like in the UK or here in Canada.
For a BMI of greater than 22.5, the vegans had lower risk of hip fractures.
Yeah, I think it was I don't think it was a huge effect size there if it wasn't indeed a lower risk, but yeah, a little bit. They were below 1 anyway, so a little bit lower, if I recall.
No one's talking about this.
No.
You mentioned fortified foods. A block of tofu can have almost 1,000 milligrams worth of calcium if it's 50.
Calcium set.
You can look in the ingredients, right, to see if it's got calcium sulfate as the setting agent. But are there any risks then of getting too much calcium because of the fortified foods and the tofu? If you're a bodybuilder, for example, and you're eating tofu 3 times a day, you could be getting potentially a lot of calcium.
Yeah, so here in Canada anyway, I have a hard time finding calcium set tofu. We typically don't, so it's a much more modest dose of calcium you're getting. But as far as risks, usually what people are concerned with are the potential cardiovascular implications. There's some research suggesting that calcium intake, particularly supplements, may increase risk. But I've only really seen this in populations where they're already consuming enough or close to enough calcium. So say if we're aiming for the RDA of 1,000, you might take people who are already consuming around that amount, and then they're supplementing like another 1,000 on top of that. And in those cases, I would say it's possible that there's an increased risk from what I've seen, but I wouldn't really strongly claim anything one way or another. But from food sources, I haven't seen anything like that. I know you mentioned, in a bodybuilder, if they were consuming 3,000 milligrams, I haven't seen data on that from food sources, really. That's more so from supplements, potentially. So it's tough to say 100% in that case. Generally speaking, I would just say to add to that really quick, generally speaking, if someone's just supplementing enough calcium to hit their needs or to meet their needs, then I don't really see any concern. as far as heart disease risk.
And what's your view if someone doesn't have calcium set tofu or fortified milk? Can they still reach the RDA?
It's possible, it's just a lot harder. So yeah, I actually have one patient who actually hits like the RDA or above the RDA with just food. And for some reason, he doesn't want to take the fortified milks or whatever. And hey, if he's hitting his targets, I'm okay with that. But I would not generally recommend that. It is just much harder to do. And there are foods like almonds, almond butter, broccoli, certain greens, blackstrap molasses, if you're using a sweetener, is actually a decent source. Tahini can be a decent source. But there's just too much focus that needs to be put into it. My kind of thought is I want to make it easy for people. I want to make it something that you don't need to hyper focus on. Like if you have a cup, or even, especially if you have 2 cups, but even a single cup of a fortified plant milk or a fortified orange juice or something in a day, you're probably going to be fine. You'll get the rest of the calcium through food sources. But if you were not having any of that, you just have to focus on it a lot more.
Chia seeds are also a good one. There are some strategies, but
it's needless. Like I think there's no point to have to hyper focus on those things, in my view, right? There's just a much easier solution.
Before I used to do the same thing with iodine as well, trying to calculate how much salt I need to add or nori sheets I need to eat. But then you can just take a multivitamin and get all your iodine and not have to take iodized salt or nori. What's your view on iodine?
So I'm definitely more of a fan of iodized salt, or for those who are watching their blood pressure, there are the potassium-based alternatives to salt that taste a lot like salt, but can actually be good for your blood pressure, help lower your blood pressure. With that, it's like half a teaspoon and you've met your iodine needs if it's fortified. The problem is our beverages generally, I don't know about over where you are, but here they aren't fortified with iodine, the plant-based milks, whereas dairy is a source of iodine for dairy consumers. And that's because it's fortified, or they like clean the udders with iodine is one of the ways I've heard that it gets in there. So I like the salt approach or a supplement if you're not doing that. Yeah, there are nori sheets. You have to eat a fair amount. It's, I believe, like a full sheet to get a decent amount. There are other types of seaweeds that can have it, but it's super variable among seaweed. That's the other problem, is you don't actually know exactly how much you're getting from seaweed because the source really matters. And then some types have too much iodine, and that's also not good. You don't want to end up with too much. So for all those reasons, I think the salt or supplement's the easiest way to go about it. And I mean, there are some decent multivitamins out there that cover your iodine needs and your B12 and your vitamin D in that all in one package, and you just don't have to worry about it. So again, I'm all about making it as easy as possible, right? Without having to hyper focus on these things.
I think the nori it depends also on the source.
Exactly. Yeah, that's the problem with the seaweeds. It depends on the source and what you're getting. So not super reliable.
Just take a multivitamin.
Exactly.
Cardiovascular health. There was a study saying that vegan diets are associated with a greater risk of hemorrhagic stroke. I'm sure you've looked into this as well.
Yeah, so that was also the Epic Oxford study, like where, the study we looked at for fracture risk. So in this study, they found that, vegan diets were associated with a higher risk of stroke. And if you look at the different subtypes of stroke, it was actually the less common form, the hemorrhagic stroke, that seemed to be driving the results. And what's often left out of these headlines is that it wasn't vegan specifically, it was vegetarians as a whole. I want to make that clear. It wasn't strictly the vegans. And if you look at the subgroup analysis, the results weren't statistically significant for the vegans, but again, can't say for sure that there wasn't a risk. So amongst the vegetarians, they had roughly 3 more cases of stroke per 1,000 people, but they had 10 less cases of ischemic heart disease per 1,000 people. So as far as cardiovascular disease goes, there was still a net benefit, and that always gets left out of the equation. Now, one of the things that is probably driving this is, so if you look at a cutoff of age 70, under age 70, the vegetarians didn't have a significantly increased risk. Above age 70, they did. And that's important because age is a big risk factor for hemorrhagic stroke. So what could be happening, and there are some publications about this, it's called a competing risk, where if you have a heart attack and die, you're not going to have a stroke. Right? That should be pretty obvious. And so ischemic heart disease is a competing risk for stroke. And so it could be the case, because the omnivores were more likely to have heart attacks, they were just having heart attacks at younger ages and not making it to the later ages where they might have a hemorrhagic stroke. And this study just didn't consider that. They didn't do a competing risk analysis or anything like that to consider that. Now, shortly thereafter, there was another publication, a couple of Taiwanese cohorts where they compared vegetarians to meat eaters, and they adjusted for ischemic heart disease. And the vegetarians actually had a lower risk of stroke. And in the second cohort, actually a lower risk of hemorrhagic stroke as well. Of course, that got zero media attention. And these are just two studies out of the several that have been released since. And there was actually a meta-analysis that was published shortly after that came out and suggested that vegetarians were not, at least as far as a statistically significant association, there weren't any significant associations between vegetarian diets and risk. And then there's actually a possible lower risk in the age group of ages 50 to 64 for stroke amongst the vegetarians. So the data really points to there not being a higher risk of stroke, or at least not likely, and possibly even a protective effect in that lower age bracket. So I think it's just a kind of misinterpretation of the results, and often the issue with the ischemic heart disease gets left out of the equation.
In the paper, they write, for stroke outcomes, the combined results from 2 randomized statin trials reported 21% higher risks of hemorrhagic stroke per 1 millimole per liter reduction in LDL-C.
I'd have to look at those trials specifically. So just speculating a little bit here, I wonder if it could be a case where they had, again, lower risk of heart attack, but then later on went to have a hemorrhagic stroke as well. That's totally possible, but I just have to look more into that one.
To understand properly the concept, people who have a diet higher in saturated fat, they are more likely to die from a myocardial infarction. And so it seems like they're not dying as much from hemorrhagic stroke.
Later in life. Yeah, like the hemorrhagic stroke. So there's actually a really good paper, I can send it to you, on competing risks in cardiovascular disease research. And they really talk about this concept. Yeah, it's a super good read for anyone who's like super interested in this topic. So I can send that over to you and you can put it in the notes.
Please do, that would be amazing. Yeah. Thanks a lot for tuning in. You can support Foolproof Mastery in a number of ways. First of all, please subscribe to our YouTube channel and leave a review on Apple Podcasts with an honest opinion of what you think. Leave plenty of comments on YouTube and share with your friends, family and colleagues if you feel that you have learned something new, in order to keep on getting the knowledge out to as many people as possible. Finally, keep on living every day to the maximum, and see you next time for another episode. Ciao.